So here in Seattle at the Bezos Family Immunotherapy Clinic, which was one of the first clinics set up for cellular immunotherapy, we have a wide range of clinical trials available for patients, as well as both of the commercial products. So the exact mix is kind of tricky because it depends a lot on when cells can be potentially available, the actual histologies and the diagnosis of the patients, and then insurance coverage. And so many times these dictate whether patients are going on clinical trials or getting commercial agents. I think the commercial agents are picking up over time, but right now it's been a minority of the patients have been on commercial agents, and the majority have still been on clinical trials. Well, there are many challenges associated with the delivery of CAR T-cell therapy, and right now we have a limited number of centers that are approved to be able to give the treatment. And so for this to be more widely accepted, there are several things that have to happen. One is more centers have to be set up that can safely do this treatment. And then secondly, the companies have to be better at product delivery and in hopefully even shorter time frames so that patients can survive long enough to actually get to the therapy. I'm not aware of any centers, community centers, that are functioning as CAR T-cell approved centers at this time. There are a number of major hurdles that have to be overcome for this, I believe, for this to happen. The first one is FACT accreditation. So I believe that the most insurers will eventually require that centers be FACT accredited in the new immune effector cell criteria. And most transplant programs are already doing this. And so that's why most of these programs have been associated with large academic programs such as transplant centers. It is quite a challenge to become FACT accredited, and the major issues are actually not just taking care of the patient, but ensuring that there is chain of identity between the collection of cells and the delivery of those cells to and from the manufacturing center, and then administration back to the patient. Well, I think there are many challenges, again, to outpatient delivery of CAR T-cell therapy. Here in Seattle, we have extensive experience in being able to do that, but that's because we have a very robust transplant program that developed outpatient allogeneic stem cell transplant. Because of that, we can ensure that we have 24/7 triage available for patients. Patients are required to live very close to the center, within 20 minutes of the center, and they then have to be directly admitted to the hospital middle of the night or any time of the day for the occurrence of symptoms consistent with cytokine release syndrome or neurologic toxicity. So centers have to be able to address these issues. And so 24/7 access, a direct admission to the hospital, as well as all of the other factors associated with safe administration of CAR T-cell, through the REMS programs and through FACT accreditation.